This simple image explains why some of the most common medications can quietly damage your heart, especially after 60. And if you really want to understand what's putting you at risk, make sure you watch this until the end. If you're over 60, what I'm about to show you could completely change the way you look at your daily medications. Because the real danger is not always the illness itself. It's often the pills people take every single day without thinking twice. And when these medications start building up in an aging body, they can silently raise blood pressure, disrupt heart rhythm, and increase the risk of a heart attack or stroke. Let me show you exactly why this happens and why it matters more than most people realize. So watch this carefully.
For over 20 years as a cardiothoracic surgeon, I kept seeing the exact same anomaly. Men and women in their 60s and 70s were landing on my operating table with massive heart attacks and strokes. These weren't reckless patients. They followed their doctor's orders. They filled their daily pill organizers every single morning and took their medications exactly as prescribed. Yet their cardiovascular systems were still failing. The root cause of this anomaly starts before those pills ever reach a pharmacy. When a new drug gets approved, it is overwhelmingly tested on 30-year-olds, healthy adults with highly efficient organs, treating exactly one condition and taking zero other medications. By the time you reach 60, your internal chemistry operates completely differently. Your kidneys filter more slowly. Your liver breaks down compounds at a fraction of the speed it used to. A single pill that clears a young person's system in hours can linger in an older body for days. And older Americans rarely take one pill. The average person over 65 takes 4 to 5 different prescription medications every single day. The medical system tests single variables on young, efficient bodies. You are taking 5 variables at once in an aging body. The gap between a drug being prescribed correctly and actually being safe for you is exactly where preventable cardiac emergencies hide. Some of the most common everyday medications attack the physical plumbing of an aging cardiovascular system, acting as invisible pressure builders. Take over-the-counter painkillers like ibuprofen or naproxen. When an older adult uses these regularly for aching joints, the drugs force the body to retain sodium and water. That extra fluid directly elevates your baseline blood pressure. This diagram shows what happens when you add a decongestant containing pseudoephedrine. These cold medicines are designed to clear your sinuses by constricting blood vessels. The problem is they don't isolate your nose. They universally constrict vessels throughout your entire body. You now have a higher volume of fluid trying to pump through narrower pipes. This mechanical strain forces an older, already vulnerable heart engine to work incredibly hard, drastically increasing the chance of a clot forming. The clinical data reflects this physical stress. Regular use of NSAIDs in people over 65 increases the risk of a heart attack by up to 50%. Millions of people treat minor joint aches and temporary sniffles with over-the-counter boxes that secretly push their aging cardiovascular engines past the breaking point. While pain and cold meds assault the physical plumbing, another set of common prescriptions targets the heart's electrical grid. Older classes of antidepressants, specifically tricyclics, interfere directly with the electrical system that controls your heartbeat. In an older heart, this interference causes a dangerous delay in the electrical reset cycle, a condition known as QT prolongation. That electrical delay gets worse when you add first-generation antihistamines. Seniors frequently take medications like Benadryl to help them sleep, entirely unaware that the active ingredients compound that exact same electrical disruption. Then there are system crashers. Older diabetes drugs like sulfonylureas work by forcing your pancreas to pump out more insulin, totally blind to whether your blood sugar is actually high or not. This blind production drives blood sugar dangerously low. In an older body, the classic warning signs of low glucose are often blunted. The patient feels nothing, but the severe drop directly triggers dangerous cardiac arrhythmias. Patients simply trying to manage their sleep, their mood, or their blood sugar with outdated prescriptions end up short-circuiting their heart's natural pacemaker. The true danger rarely comes from an isolated pill. The greatest systemic threat in elderly medicine today is polypharmacy, the unmapped intersection of multiple active prescriptions. Let's look at this diagram of a standard scenario. A 72-year-old woman. She takes ibuprofen for her arthritis, an antidepressant for her mood, and occasionally grabs a Benadryl to help her sleep. While she rests, the ibuprofen actively raises her blood pressure, placing heavy mechanical stress on her arteries. At the exact same time, her daily antidepressant is disrupting the internal electrical rhythm of that heavily strained heart. Finally, the sleep aid kicks in. It blocks key neurotransmitters, unexpectedly spiking her heart rate in a highly vulnerable state. Because these overlapping interactions are rarely studied in clinical trials, no one warns her. The cardiovascular risks of these three pills bypass simple addition. They multiply into a deadly, silent assault. I've held enough beating hearts in my hands to know that most of these late-in-life cardiac emergencies are entirely preventable. Safer alternatives with proven cardiovascular benefits exist for almost all of these conditions. A simple switch to acetaminophen for joints or a second-generation antihistamine for allergies provides relief while stripping away the cardiac risk. To protect yourself, grab one piece of paper, write down every single prescription, over-the-counter pill, vitamin, and daily supplement you currently take. Put it all in one single place. Take that comprehensive list to your pharmacist or doctor and actively demand a medication review. Ask them to look closely at the entire list to flag any dangerous combinations or electrical multipliers. But hear me clearly. Never abruptly stop taking a prescribed medication on your own. Any adjustment needs to happen under strict medical supervision. The medical system cannot automatically account for the compounding chemistry of aging and polypharmacy. An informed, proactive patient asking the right questions is the best defense against a preventable heart attack.
Now you understand how the medications you take every day can quietly affect your heart without you even noticing. The real danger is not always one pill. It's the combination over time. The good news is, this is preventable if you stay aware and review what you take regularly. If this helped you, make sure to like, subscribe, and share this with someone who might need to see it.